Lifestyle Affects Health and Disease, an anthroposophical medical perspective by our guest speaker, Robert Gorter. I'm Eric Pepper, the host for this program. Robert Gorter, who is our presenter, earned his medical degree at the University of Amsterdam Medical School in 1973. At the same time, he also completed his anthroposophical medical medicine training with an emphasis on oncology in Switzerland. And since 1973 has been recognized as an expert in the field of anthroposophical medicine, as well as in teaching anthroposophical medicine. Starting in about 1973, his clinical range has included holistic perspectives. For example, between 1973 and 1982, he explored the clinical use of cannabis for treating heroin addicts with marijuana, 2 joints a day, instead of methadone in Amsterdam in the clinic of Jelinek Clinic. In his own inpatient clinic, he also treated heroin addicts with acupuncture, as well as set up a needle exchange program. In 1982, Robert emigrated to the United States and became the clinical faculty at UCSF in San Francisco, and starting in 1984, collaborated with Eric Pepper at San Francisco State, where he has continued to teach a class every few years in anthroposophical healing studies. And he has also been highly involved in the AIDS research. So in the years of the 1980s, at the height of the AIDS epidemic, he was the medical director of the Department of AIDS Epidemiology and Biostatistics. In 2000, he founded the Medical Center of Cologne, dedicated to the treatment of cancer using dendritic cell vaccinations, adult mesenchymal stem cells in combination with immune supportive therapies and hyperthermia. He describes this work in his book, which he co-authored with Eric Pepper, called Fighting Cancer, a non-toxic approach to treatment. Dr. Gorter has written numerous articles and abstracts, contributed to many books, and taught internationally at least 6 international universities. And as stated earlier, he has been, and at times is a lecturer at San Francisco State, teaching the course Anthroposophical Health Studies. He focuses on exploring the strategies to optimize the immune system to prevent illness and maintain health. Robert, it's such a pleasure that you are here, and I really want to thank you so much for taking the time to present.
Well, thank you. Thank you for inviting me, for asking me. And only when I listen to my introduction, I think I can only be a disappointment afterwards, but we'll see. But I'll do my best. And the theme, the subject of my contribution today is about health and disease, and how do I maintain, or how can I improve my health? Yeah. And you also see that on medical schools, medical students and doctors in training are taught everything about disease, but very little about health. Yeah? Because and if you ask even the World Health Organization, what is health? They come sort of with a very crummy description, but they can say everything about disease. So I want to address what we can do to maintain good health or improve health, what you can do, and that had different components. So maybe I made the first slide just to summarize them. And so you can ask yourself, what determines health and disease? Yeah. Now, of course, you could also summarize it and say, well, your lifestyle is very important, and that has different parts, and the lifestyle include also how you are raised in early childhood. We'll see that later about the development of the immune system, your nutrition, whether you eat only hamburgers, or whether you eat organic food and vegetarian. Also your mental functioning. There's also Dr. Pepper is an expert in. That is stress management and your mental functioning, and so how to stand in life and feel about yourself. And then drugs, but not only drugs, if we think of heroin or so, but also many prescribed drugs by the doctor. Can be morphine or heroin related components, or tranquilizers or sleeping pills, and all of those. There's an endless body of literature that they're all immune suppressing. So they have also, it's not only when we talk about drugs, illegal drugs, but also legal drugs. And then immunizations, we'll talk about a little bit. And I want to say already now, I'm not against immunizations. I had 2 immunizations. We'll talk, I could explanation later, but it is how do you do it, and at what age do you vaccinate? And then a rhythmic life. We also talk about the circadian rhythm, and that means a 24-hour rhythm, and there is a significant effects on all of your hormonal production and also stress hormones. If you have a good rhythm and a good circadian rhythm, 24-hour rhythm. We'll talk about that also. And then, of course, sterile versus dirty environment. We'll see, but I can only in a brief presentation now only give you a little impression what had been published. For instance, that little children growing up in an environment of farms, that they have a better immune system and less, for instance, allergies than those who are very clean and sterile, grew up in the city. So, and then of course, yeah, that is, we talk about the anthroposophical perspective. For me, also karma plays a role in health and disease, but further also effects from the environment, like pollution. Of course, we all know a lot about pollution, so we won't talk much about that, but also genetics. There are, if you have, although that's not absolutely determining your health and disease, but certain mutations, certain genes can put you more at risk for cancer or for other problems. Okay, next slide. Can we do next slide then? Yeah. So, and then also in the studies, I will briefly mention and tell you the conclusion. They are usually so then there are cohort studies, and then they say there is a strong correlation. Now, what does this mean? Okay. For instance, as an example, there is a strong correlation between smoking, and then not one day that won't kill you. But if you do this for years and years, so part of your lifestyle, then smoking is strongly associated with not only cancer, but also heart disease, blood vessel disease, dementia at later age, and so on. So smoking, you can say, is bad for you, but there are several studies showing there's a strong correlation. But this means that when I smoke, I will automatically get, let's say, lung cancer, because also people who never smoked themselves, they can have, but much less, also lung cancer. Yeah, but sometimes little children, when you grow up, you are a passive smoker. That one of your parents or both of parents or somebody in the household smokes, and also passive smoking has a significant negative effect on your immune system. And there was also a study, which I will not present now, that young children admitted to an acute asthma attack, they almost always came from households where at least one person was smoking. So, okay, next one. So, now, first of all, I want to say there was a nice study done in Sweden and also published in The Lancet. That is one of the top 3 leading medical journals. And they compared almost 300 children who were on a Waldorf school, compared to some regular children. That meant children that were at other schools, public schools, but with same or comparable socioeconomic background. And they were compared. And so the next one. So what they did, for instance, to look is that you can do a skin test for allergies. So maybe some of you might ever have had that the doctor puts like on the inner side of your arm a little stamp with 6 or 8 needles, all with a certain antigen. And then a day later, you will get where you have an allergy, there will be a little red bubble, almost like a mosquito bite, so to speak. And if you have no allergies or none of them or only one, then you don't have them. So that was compared. And and then also there was a history taken of how many vaccinations children got in early childhood, and also the number of events of fever, that the child was really sick and the temperature was roughly about 39 degrees Celsius before age 6. The age 6 is sort of an important, let's say, age, well, and we get ready to go to school. That's age 6, but also we are changing teeth, and that's also a major step in towards adolescence and adulthood, that you shed your first set of teeth, and then you get your permanent teeth. That is so around the age of 6. That's very important. So what did they find? So they compared them, and it was a cross-sectional study, and they compared 300 children in Waldorf schools and in regular schools. And for instance, what the difference with the children from the Waldorf school was that 52% ever had antibiotics versus 90% at a regular state school. So there was really almost doubling of the children who got antibiotics, and usually more than just once. And then 80% of the Waldorf school kids had the immunization MMR, and until almost all of them, 93% in the control schools. And then 61% of the Steiner children had measles, so active infection, they were sick. And only 0.5% at the control schools, because they were all vaccinated. And also in between, I was also a school doctor of a large Waldorf school in Amsterdam with 3,500 students. So, and when we had a child with measles, we threw a party at that house, and so that many children were exposed to the measles and also had then an active infection and therefore also lifelong immunity. And that's also important. That's about nutrition. And 83% at the Waldorf school kids, they had regularly fermented vegetables, and that is done with lactobacilli, so with live lactobacilli, but also, let's say, in yogurt and curd, that also with a live lactobacilli. We'll see that it's very important also for your intestinal flora, which is also a main part of your immune system. And then the skin prick test showed much less allergies, atopy as it is called, compared to the regular school kids. And then you also could see that the anthroposophical line, so the bottom line was that the anthroposophical lifestyle and the risk for allergies, essentially, also including asthma, was very significant, with a p-value less than 0.01. So you could really say that it was strong data to suggest that the correlation is, in my opinion, my perspective, with such a small p-value, that it was more than only a correlation, so to speak. You get towards, let's say, effects. But the others, remember, I said, it is an association or a correlation, but it's for sure, it documents at least a trend. Yeah, next one.
Well, before doing that, let me just make a comment or two, if that's okay, Robert.
Yeah,
remember,
please.
it is an inverse, for everybody, it's an inverse correlation. So it looks like that the anthroposophical lifestyle reduces the risk, essentially, you could say, of older children not having allergies. And what is so interesting about this perspective is it is a way of us. It's really thinking beyond the traditional model a bit and asking, how come so many people today, young people, have allergies? Probably if you think about it right now, how many of your friends have allergies? And that is something totally new. If you ask your grandparents, when they were going to school, in high school or junior high school, they would probably say maybe 1 out of 40 or 1 out of 100 had sort of the classical allergic reactions. Now it's 30%. And to me, that is what is useful, to look at these other perspectives to say, is there maybe something going on that we have changed over the many years? And that has made us more vulnerable, our immune system. And here, at least, are suggestions from different lifestyle patterns, because that's really, and that kind of anthroposophical lifestyle, eating fermented vegetables. Remember, that can be sauerkraut, it can be kimchi. It varies, or having a very low incidence of using antibiotics, which would affect your human biome. And possibly allowing yourself to have fever, which would possibly mature your immune system, as a hypothesis, as Robert would later talk about. Maybe factors which start early in life, but have long-term outcomes, which we don't usually assess. Much of Western medicine tends to very quickly assess now and then for 3 months. These studies start looking at long-term effects, which are often very difficult to identify. Robert, sorry to interrupt.
No, please, it's perfect. Just one personal note. When I went to high school, we were with roughly 3,000, also 500 students. And we had one who had hay fever. And then in the spring, so usually in April, in Holland, when things start to bloom, especially trees, then there was a hachi, and then we all make little jokes about it. There was only one, and that's why it was funny. So 3,500 kids, we had one with hay fever, and gluten allergies. Nobody had ever heard of that. So and now it's also a significant component of allergies. Okay, so
I would even confirm that what Robert is saying, because I was also born in the Netherlands, and when I was going to school, my numbers were a little different, but in my class, there was one young student who had these kind of allergic reactions and asthma. But that's 1 out of 40. And now it's 1 out of 3, which is shocking. But note also on the next slide, which Robert will point out, is that the Waldorf school, people allowed the children to have fevers, something we don't do today. And the parents tend not to suppress the fever with NSAID medications. Robert, take it away.
Yeah, that's also important, because when you're younger, and also some also studies even published in pediatric journals, which show that if you have not had or hardly had really a fever also before age 6, you have a much greater risk to have all kinds of allergies, but also your immune system is not up to date, so to speak, because your immune system, or you could say that fever is like aerobics for your immune system. So you need to have a couple of fevers also before HS, but also we'll show later. it is good when you're an adult and every 4 or 5 years or so, you have once a period of a fever. And that's probably also the benefit of flu epidemics. Yeah, that when you have the flu, and maybe you remember you have a sore throat, maybe a couple of days, you get some fever. But actually that's good because cancer patients, we'll talk about that later. So now the atopy in children with families and enterostomal colitis, the conclusion is that Waldorf school, Rudolf Steiner schools, the students, and also later in life, they have significantly lower allergies. So atopy is a medical word for allergies over your skin, like eczema or asthma and so on. And also, so therefore also there's less risk later in life to still get an allergy. Yeah, and that is very much the possible malignancies in later life. It is so when your immune system couldn't really move or get to training or so, and then they are less fit to defend yourself against also malignant cells. Okay. So and there are some journals also in Lancet, the study with the anthroposophical students in Jena, that was then also done in the Lancet and so, but also several studies showing that children who had less or vaccinations or non-vaccinations, that they overall did better, or if they came from a dirty environment. It's a very nice study also done in South Korea. And you see there that children from with a background, they grew up on a farm, are much healthier from an immunological point of view than kids who grow up in a very sterile inner city environment. Yeah, and this is also, although I would say this is also a study from an American university, Jackson State University, Florida. And it shows that if you are treated with Tylenol quickly for any fever, and you get all your vaccinations and never really got once or twice really a nice fever for a couple of days when you got the measles or this or that, then you have much more problems in life, from also attention deficit syndrome to also there's a strong also correlation with autism and so on. I don't want to go into that, so I only want to say I'm not against vaccinations, but you should not do it too early. Let me say one thing. I got vaccinated at San Francisco General Hospital and UCSF, dealing with AIDS patients. I got vaccinated against hepatitis B, because with blood contact and so, and maybe finger prick, you could get infected with hepatitis B. So I was vaccinated. There's now also law, high-risk group, to be vaccinated against hepatitis B. So of course I did that. Yeah. But now, and then the rule was you get vaccinated for hepatitis B if you have a high-risk job, high-risk person. So again, that was mainly medical personnel and surgeons and doctors. Now, the latest recommendations from the World Health Organization is, and since about a year, and it is done globally, also in the United States, to vaccinate babies of 4 weeks old for hepatitis B. Yeah, and you see that little children and young children, they need to arrive on the earth, so to speak, and you can't overload them with all the vaccines and the additives in there. And also babies, newborns get antibodies through the placenta from the mother, which should last for about 10 months. So also there is not really a reason to vaccinate also at 4 weeks age for something which was only done for people at a high-risk group.
Okay. So if I make a comment in here for a moment, Robert, I think for vaccination or anything else in medicine, it's always risk benefit. Yeah. And just like getting vaccinated for polio, the risk, if you get the disease, is so much worse. Even if there are rare side effects, it's worth the risk. And the question is, with babies and all the other ones, that's what people need to do. Remember the positive correlations we saw earlier about the children who did not get it early on, the vaccinations, or had an anthroposophical lifestyle, and they seem to have less immune disorders. Remember, you have to always, it gives a hint what to look for to start opening the window. You have to keep in mind the responses were self-reported. That could make a bias. Remember, overall, people who vaccinate or not vaccinate may be, in fact, have other unreported differences. They may not be using antibiotics. They may be eating a different diet. All these subtle factors, they may allow the children to play more in the dirt. And we don't all know those. And that's why all this kind of data is really food for thought. And what Robert does say is that, you know, when a baby is just born, you know, if you give a lot of vaccinations at once, it's a stressor for the system because the system has to, in some ways, fight these mini infections.
Yeah, and also just and the system of a child, a newborn, is not ready yet. And of course, already when you start changing teeth, you are much more ready. Or at age 3, it's important in your development when you can say no, and a child at age 3 can say no, and then they also are happy to say no. Anyway, so therefore,
let me add one more part. And the final piece is on many. So it's not that any. It is that sometimes childhood illnesses, if you get them as a young child, you pretty well can go through it easily. But if you're an adult, then it's very deleterious. And that's where the challenges lie.
Yeah, that's like the measles. Have you, as a child, get the measles, then you're a couple of days sick, but you, but actually we also know now in the spots on the skin with measles, that is where your dendritic cells, we'll talk about that later, go through a maturation. So if you never have the measles, then although therefore your immune system, we know now a lot, is less capable of killing cancer cells. And therefore, also there is really a concern that when you have a not well-developed immune system, or a very one-sided activated immune system, and therefore allergies, that also the increase of the incidence of cancer will increase, will be dominant. Anyway, so now here is then the circadian rhythm. And now let me something about.
This is about fever for a moment.
Okay. Yeah, okay, good. That is so. Fever. Okay. We often, also medical students, young doctors, even at UCSF, they are taught that fever is one of the major causes of disease. But that is, of course, not true, because fever is a sign that your immune system is stepping up in its defense mechanisms. Yeah. So also when you look in evolutionary biology, you see that those animals, those beings, especially only actually mammals, and then us humans, we are most able to defend ourselves against all kinds of infections, but also malignancies or cancers, because we have we can make, among other things, fever. Yeah, and so fever is a sign that your immune system is stepping up its activity. Now, of course, as a doctor, also as parents, you have to look and know what to look for, because a fever, especially your children, is almost always fine. But still, you would like to make sure that there's not something more sincere than only a viral infection. So, but therefore also I teach often parents from a Waldorf school, or the parents from patients. What can you do when a child has a suddenly high fever? There's always on a Friday evening. What can I do? And what works very well is a lemon wrap, which I will some other time explain. But then you put essentially a wrap around the calves of the lower legs of a young child with some lemon juice diluted in water. And usually you see, if it's fine, there's nothing major going on, then even if the fever is very high, 103, 104, usually the temperature comes down then within half an hour for even 1 or 2 degrees, but you don't suppress, so the fever doesn't get is not gone, but maybe when you take Tylenol or so, but it is then much better. So child feels comfortable, wants to drink, maybe wants something to eat, and then you know for sure it's fine. Yeah. So, but you don't suppress completely the fever. And that is also literature showing that as a little child, when my mother or my parents or my doctor gives me right away with any fever, acetaminophen or Tylenol, that I will then decondition, that my brain, what it was, the whole in the brainstem is a very important temperature center, and I can then sort of decondition, and that the this temperature center in the brainstem doesn't know how to really augment the fever. Yeah, so therefore I think, well, I'm not only, but it's from my perspective, but many share this, that fever by itself is actually part of your natural defense mechanism to battle stress. Even I once had my wrist broken, and in the hospital, that I got a pin in my wrist and so, and then I had a fever that night and the next day, and they said, oh, antibiotics, and I said, no, also an operation, a cut that is stress, and immune system will right away respond. So, and of course, a day later, I had no infection and the fever went down. But there's always like also a conditioning by many healthcare providers. Fever means bad, means Tylenol. Yeah? And that's a thing that shows, there's a lot of data that is very likely not true. Yeah? But when you see these correlations, that gives for sure a direction, but not in detail. Then you must do a prospective controlled study. And these are used, but still, they give a direction also maybe where to continue to do clinical research. Okay.
And in fact, with the fever reduction in mothers, pregnant mothers and babies, that prospective studies have been done. Most interesting, they are double-blind studies looking at 84,000 febrile kids who received either low-dose ibuprofen or high-dose ibuprofen or Tylenol, acetaminophen. And what they then found clearly upon follow-up of these kids, that by age 6 or so, for those who got the Tylenol, they had an increased asthma system, chronic rhinocongitis, that's kind of nose, congestion of the nose, eczema, etc. And that is very important. Now, it may be, to be on devil's advocate, maybe it was not the fever, maybe it is because Tylenol affects liver function. That could also be partly true. However, it seems that the fever argument is one to really think about and to say, well, maybe us we often think of, we have lived for thousands of generations with bacteria, with viruses, and our bodies have developed optimum immune responses. And fever is one way to activate that. So if we suppress that, we maybe induce long-term risk. And that to me is a more novel perspective. And I would say, as Robert very carefully points out, it doesn't mean you just forget about it. You really monitor very carefully. And if it gets a bit higher, then obviously like 103 or so, you better, either do something to reduce that fever with the lemon wrap, water around the calves, and automatically do contact your doctor.
Yeah. If the fever doesn't go down, I will say wait
Correct.
for half an hour, because the effect is usually pretty quick. But if it doesn't, then call and half an hour is always okay. So
could you maybe comment more about the circadian rhythms?
Yeah. Okay, circadian rhythm, and that's also very important. Let me summarize, and also later on my email address will appear, and if people still have questions, students have questions, want to know more, they can approach me per email. I can even send maybe then some articles per email. Yeah, but the circadian rhythm, what is a circadian rhythm, especially the core body temperature? You see, essentially, we have some graphs of that early in the morning. So by the time I wake up, so let's say, 6 o'clock roughly, my core body temperature, which is measured rectally, is then at its lowest. And during the day, also when I don't do much, I sit in front of the television or behind a computer, in front of the computer. But at the end of the day, so usually at 5, 6 o'clock, sometimes at 7 o'clock, your core body temperature is the highest. And then during the evening, and when you are asleep, then it goes back to the temperature as it should be or is early in the morning. And the difference between the early morning temperature and the late afternoon, early evening temperature can be up till 1 degree, usually 0.8 degree Celsius. Yeah. So I'm talking now in Celsius, but hopefully you can sort of understand what that means in Fahrenheit. I forgot to.
That means, so let me interrupt. That means basically about almost 1 degree Fahrenheit to 1.5 degree Fahrenheit.
Yeah. Okay, that's so. So, and that is the difference. Yeah. So, and if you have that, that means you are healthy. You have many physiological processes function well. And therefore you see people with a significant disease, like for instance, cancer, they always have a disturbed circadian rhythm. First of all, they have a much lower core body temperature in the morning, but they also, sometimes it's almost like a stiff graph, stiff line. They don't have this up and down a sinus curve over 24 hours. And that's important to know. So, so therefore it's important to know that the core body temperature is like an indicator, but also a surrogate marker for somebody's condition, and also if they would do well in cancer therapy, if that's a good option. Yeah. So, and what we looked in our patients, and we did that in Berlin, was that we treated patients. We let them first do their circadian rhythm, that they would do the core body temperature in the morning, and then in the evening, usually we set a certain time window, but also depending a little bit on somebody's job and lifestyle, and then the people wouldn't. They got a pre-printed little logbook diary to put the core body temperature there. And then these were those, and then we started with the cancer patients. We started with Fiscum album. So that is a very commonly used plant, mistletoe in English, to inject every 3rd day. And they would get fever range total body hypothermia. That meant they went in a bed, in a tent, but the head would be out of it, and then they would like a sauna, a little sauna, and then with infrared, the temperature was increased to at least 38.5, if possible, to 39 degrees. So that is 40 degrees Fahrenheit. I think that is, how much is that Fahrenheit?
It's about 40, 100.
100 degrees. 100 degrees. So, and it's always very well tolerated. They get an infusion with vitamin C and other things. And my oldest patients were 86. She also had cancer, and for several years she finally died, of course, at 93 or so. But she did very fine also with the total body hypothermia. Yeah, and then we observed them. So, and then patients also, they were taught to self-inject the mistletoe, that is like a little insulin syringe. So what a diabetic patient does twice a week, or a couple of times a day, our patients will do that twice a week. Yeah, and then so they got every 4 weeks a fever range total body hypothermia, and so, and then this is then the graph. You see that that the lower, the black one, that were the patients, and you saw there was hardly any circadian rhythm. And then what was red, that is the volunteers, the healthy people. And what was green, that was cancer patients who went through this treatment for I think maybe three months, they had almost, no, they had for sure a sinus curve again, and almost back to normal. And those also patients, about 80% of the patients had that. And our experience was also later that if patients sort of recover the circadian rhythm, that is already a strong indicator that they will do well and they will or improve and live years longer or go in complete remission. Yeah, and remember these cancer patients, they were actually always end stage. Yeah, so stage 3B or 4. So they had not much, 3 to 6 months maximum life expectancy. So now what is interesting, that all these cancer patients, because of the pain medication, they took some non-steroidal, so like Tylenol, they took that and or ibuprofen, or also something morphine, something also through the skin. And still, with the fever, the way we did it, the circadian rhythm improved, although they were on temperature suppressing medication. So of course it did suppress some of the fever, but not that maybe a little bit lower core body temperature in the morning, but there was an halfway returning to normal circadian rhythm. Yeah, and that
so
is.
So basically, Robert, if I think of it, what you then did, patients came in, you noted that their core temperature was really either not rhythmic and lower, which is very common for those patients.
Yeah,
and then by a combination of using the, I'll call for a moment terminology, the herbal remedy of using a specific way to prepare mistletoe, which the patients did about twice a week subcutaneously, plus the hyperthermia together, somehow in time, they got their rhythm back. And that is associated with a much more competent immune system and a better recovery from their cancer.
Exactly, so is it. Yeah, and yeah, that's the bottom line. But now it's also, you can also do this as a marker whether you're at risk for cancer or not, because we did quite a few. There's a little bit of prospective study. Let's say family members from the patient. They said, well, how is my they also did the circadian rhythm, and they also had clearly lower core body temperature and so on, so as if they were cancer patients. And then we also treated them with hyperthermia, and they took for half a year, then twice a week mistletoe, and then they also would improve. But those who didn't do that, so then later on in the next 5 years, there was really also a higher incidence of malignancies in this group than one would expect. So that is not a proof, but it is an association again. So it gives you food to thought. We should further look into this. Daar is etwas dran. Het was there, sort of like a trail which we should follow to prove it or to disapprove of it. So it's a hypothesis, but a little bit more than a hypothesis, because otherwise you couldn't show strong correlations.
Well, what is so interesting, Robert, is that if I think about all this, and now we think of the pandemic for a moment of COVID-19, that it's interesting that most 94% of people who die have essentially die with COVID and comorbidity. They have a couple of comorbidities, which is usually chronic diseases, which may also be a factor. So the question then becomes, could you make a few comments about the immune system and then how to opt factors that maybe inhibit the immune system and factors that enhance the immune system, because that can be relevant for us today.
Yeah, kijk, of course, you could say anything which will support or improve immune function is, and so most of the things we know, that is, it's things from the environment, from outside. When you see how we are exposed non-stop to electromagnetic fields and electromagnetic radiation, whether it's from, I think 5G towers to just when you sit in your car with your dashboard and you sit in a Faraday cage. And so we are all that. And now you mobile phone, there's now more and more data. If people are 4 hours per day on the mobile phone and they always listen to it with the right hand, then there is a significant increase, but after 8 years or so, of cancer of the brain or the nerve leading to the ear on that side. Yeah, or women with breast cancer, when they put, especially California, nice weather, then they put their mobile phone on, so in their bra, and then on that chest and that breast and that location, there's a significantly increased incidence of cancer. And that is not hypothesis, that's really, or that's really true, I think. And therefore people should be more aware of it, especially when you travel. And one more thing also for your health, when you sit in a car or so on your on your bicycle, and you have your mobile phone on and you move through space, through a location, then every time your telephone is searching for the next tower, yeah, and then your mobile phone becomes like a radio. It's sending signals and see if that comes back. So if you travel, or even your car, at least what you should do is put your mobile phone on airplane mode. Then you are much less at risk for this continuous radiation which comes from your mobile phone. Yeah, because I'm not against mobile phones. I have one. Yeah, but I always put it away from me, and so at least 2 feet away. And also when I travel, I don't have it in my pocket. And almost all my friends who had prostate cancer, when I asked them, well, why do you wear your mobile phone? Yeah. Which side? No, right side. Yeah, and there they had, on the right side, they had the prostate cancer. And that is really a correlation. Also, people have looked at that, also in Switzerland. And there is, again, a very strong correlation. Yeah, thus it is more than an idea that radiation also from your mobile phone is important, especially when you move around or when you make a telephone call. So that's also part of your health. You should, in our modern life, it's all these issues which you should once look at, and that will be a whole other hour, which could maybe talk about just electromagnetic radiation, and how you can, we can't stop it. We are living in a city and so that's, you can't prevent it, but how can I deal with it? That it has much less an effect on me. And now, of course, the nutrition. Also, when I was in Amsterdam, in my first clinic I was 23, 24 when I started, and also nutrition was, of course, an important component for people, especially with chronic disease and cancer. So I talked about health food and so, and then people say, well, I can't do this, I don't know how to do it. So I started restaurants, organic or biodynamic restaurants with cooking classes. So patients and their beloved ones, and especially also schools came, and we told them about nutrition, and then hands-on. How do you cook millet, or how do you this, and so things like this. And so that's about the nutrition. So it's also had the pesticides, also Roundup was one of the worst things ever. It can be in your food cycle, but also the GMOs, the food substances which are genetically modified. That is not always beneficial, so to speak. Yeah. And of course, then also are many viral infections, which can also be a burden, because many of these viruses, which I mentioned, are chronic viral infections. And any chronic inflammation is also cause for cancer. Yeah. So, and so therefore also you see, when we get older, we are more and more chronically inflamed. Also think of your joints and so, and also the risk for the increased risk for cancer is also associated with that. So CBD, cannabidiol, I want to say, something made from the cannabis plant, is a strong COX-2 inhibitor. That means cancer patients, just by taking cannabidiol, or people with chronic inflammation, improve. and that is also mainstream medicine. Yeah, but so the COX-2 inhibitors, they are, but usually the ones made in the pharmaceutical industry, they have a lot of side effects, not right away, but after half a year or so. But they were first in the early 90s, they were everywhere, breakthrough in cancer. We block the COX-2 enzyme system, and our patients already do much better. That was true. But the problem was that usually after about 4 to 6 months, more and more people got more long-term toxicity and side effects of these COX-2 inhibitors. But cannabis, the CBD, does it perfectly and without any known side effects. So that is maybe also something, maybe a suggestion for Eric. Maybe once you should spend a whole hour on the medical use and the industrial use of cannabis. Because I predict you in 20 years, all the airplanes, also Delta Airlines, will fly in airplanes which are not made from aluminum, but from cannabis. Well, explain that so.
But what you probably mean is not cannabis, but hemp, using the hemp fibers or something.
Oh yeah, hemp. Yeah, the hemp fibers. Yeah. Hemp fibers. And also even Henry Ford in the 1940s, when I was stopped in Chicago, he built cars. And the whole chassis, the whole body of the car was made for hemp plastic.
Yes. Let me go back for one moment, Robert, because for many years, you both wrote it in a book called Fighting Cancer. You described the program of how you use this kind of approach to enhance the immune system. That was a combination of vaccinations, kind of vaccinations, right, of the monocytes.
Yeah, dendritic cells.
Dendritic cell vaccination, hyperthermia, and other approaches, which for some of the terminal patients allowed them to recover remarkably. And really, it was a model which the real theme is, instead of asking yourself, how can we kill the cancer cells externally with radiation, which we need to do. I'm not saying that is not necessary to get rid of the cancer load, but how can you boost the body's own immune mechanisms so it can cope with these natural cancer cells that occur all the time?
Yeah, that's also important. Yeah, thank you for reminding me. Normally, any person, when you're an adult and you say like 150 pounds, and you don't smoke, and you don't drink, and you don't do anything God has forbidden, you make at least 100,000 cancer cells per day. Yeah, you can measure them in the bloodstream. It's not hypothetical. You can measure them, and you can also see, because of the antigen presentation, where they come from your large intestine, from your lungs, this and that. So we make 100,000 cancer cells when we are also healthy. Yeah, but the immune system is then there to recognize and early kill these cancer cells, and that's why hopefully you never ever get cancer. Yeah, but you get cancer when something is wrong or derails in your immune system. And therefore what we do, we say, yeah, sometimes it's operation necessary or this or that. I have no problems with that. But to cure cancer or to significantly improve, then you must go to the roots of cancer, and that is a not well-functioning immune system, especially that part what we call the cellular immune system. Because this is the thing, last line, the thing is that I make antibodies, so it's a humoral part of the immune system, specifically for danger which comes from outside, bacteria, viruses, and so on. But also cancer is also a big danger, yeah. But that never comes from outside. I can never get prostate cancer from my neighbor, yeah. But that means if I now have cancer cells occurring, then there's a whole additional immune system that lower animals don't have to recognize the danger from inside. And that's also we know more and so on and so on. So
let me just finally ask for the final piece, that from the research from the cancer, you asked the question basically, how can we boost the immune system? You have demonstrated some studies and research with many patients, they get better. And I think some of the same rules we could even think about right now for COVID. If we can enhance our immune system, it means reduce the factors that suppress, that inhibit our immune system or harm it, which can be some of the pesticides, as you point out, some of the radiation of, many other things around where we have some control, put the cell phone away from your body, for example, and dietary factors, avoiding pesticides. And then the most recent data, which seems to be overlapping, is the importance of vitamin D, where it seems that almost all all patients, well, let's say most patients who get seriously COVID and then die of it have at least very low levels of vitamin D, and the lower your level of vitamin D, more at risk you are, which also matches the data. As people get older, their vitamin D level tends to be lower because their skin is less able to process the sunlight vitamin D, and we're all living inside so much that we don't get the appropriate light. And so you make an argument in the following, and maybe you want to talk about that a bit more. I'll show the slide for a sec.
Yeah.
Essentially.
Yeah. Now Germany has 85,000 inhabitants. And there it is really, of course, it's a little bit estimation, but very, very well in the German style, thought through, and they come to the conclusion that in Germany, with 85 million people, 30,000 patients, cancer patients, would die less if they would have vitamin D supplementation. So in the United States, I think your population is 4 times as much. So you would have like at least 100,000 cancer patients less dying per year if they would get vitamin D supplementation, and maybe also prophylaxis. So they recommend, and also what I do, that when you're 50 plus, that you take vitamin D on a daily basis and a regular dose, or like in Northern Europe, for months and months, or there is hardly any daylight, or if there's daylight, for sure not sunlight. So people in the Northern Europe and also in Canada, they have much less vitamin D in the 5 winter months, so to speak. So, but vitamin D also part of the treatment. Also, if people are sick with vitamin D, also in the hospitals, is in Europe, they get vitamin D, and also that by itself improves significantly. And from an anthroposophical point of view, I can understand, but vitamin D has to do with your light metabolism, so to speak. That's also therefore linked to sun exposure. And of course, people often have this click or this conditioning to say, well, sunlight gives skin cancer. Yeah, but it's only when you're a lot exposed, and maybe when you're very fair, you should be a little bit careful. But you need, let's say, at least half an hour, 45 minutes per day, sun exposure. So your face, your hands, maybe your arms, and that is already enough. So let's say 1 hour. Very much instead of say 45 minutes, but let's say an hour, and that you can never get skin cancer from that. Yeah, so you must see that sun is not causes skin cancer. No, it also improves your immune functioning against also cancer, but also against viral infections. And I must say, about 8 weeks ago, I had COVID-19 because patients brought it to the clinic, and then we had to close the clinic for 12 days for quarantine. Now, and only I knew it was then, I had an antibody and an antigen test, and snell test, and I knew I'm positive. So, but if I didn't know I was exposed to COVID, there was only one day I felt slightly tired, so a little bit like, so, and that was all, yeah. And that is also with most people who are exposed also to the flu, but also to COVID-19. They don't even notice it, or have one day like me, you're a little bit tired. No, yeah, who is not once in a while tired? So therefore, but also what I still do, because I'm a survivor of cancer now exactly 50 years ago, an end-stage form of cancer, and I did no chemo or no radiation. I only did a few things, also hypothermia, and I did a mistletoe, so this twice a week an injection, and I keep doing that. Not so let's say 6 weeks in the spring and in the fall, and I know for sure that keeps my immune system very fit. Yeah, and actually I would recommend that to almost everybody. That what you can do is supplementation. maybe once take a diary for a few weeks. Do you have a nice circadian rhythm or not? And if you don't have it, you should maybe consult me. And but so there are all kinds of things we can do, and more also scientific literature, peer-reviewed literature, comes to that conclusion. Yeah.
So I think, let me go to the next slide for a moment. Robert, I really want to thank you so much for your presentation, and really for the concepts, at least the thought pieces to say, what can we do to mobilize our own immune system, our own health, and possibly ask a person from an evolutionary perspective, how did our body cope with these kind of virus and bacteria? And having fever was one healing mechanism in the sense of strength. And maybe we should not disregard that. And then there are other factors, whether it's diet or lifestyle, or now the absence of vitamin D, because we all live indoors, that puts our immune system more at risk.
Especially with Corona, you're more working at home, so even less sun exposure.
Correct. And so I want to thank you again very much. And for any of the people who are watching this, I will also post at San Francisco State on our book, Fighting Cancer, which gives really Robert's perspective in detail, which I think would be very, very helpful. Again, thank you so much, Robert.
Thank you. Thank you. And bye-bye.